Well, hey guys, welcome back to the Friday Q&A. This week I wanted to talk about sebaceous hyperplasia. I get many questions about sebaceous hyperplasia. It's something that I haven't really addressed on here before. And so today I'm going to answer all of your questions about what is it, what can be done to get rid of it or prevent it. And that sort of thing. If you're new here, welcome. My name is Andrea. I'm a dermatologist. I film fun vlogs of my life as well as plant-based recipe videos, lifestyle videos, and on a weekly basis, skincare focused content through skincare Q&As and skincare product reviews. So if that type of content is of interest to you, I encourage you to subscribe and stick around for all of the fun. Sebaceous hyperplasia is kind of a pesky skin condition for sure. It tends to occur on the face, although honestly it can occur anywhere on the body. And it tends to occur in older adults or adults, period, and as well as neonates, newborn babies also can have sebaceous hyperplasia. It's quite common in newborn babies. And sebaceous hyperplasia presents as little yellow, approximately 3 millimeter firm bumps that have a little central, oftentimes have a little what's called a central dell or are umbilicated, kind of like your umbilicus or your belly button. They have a little dent in the center. They can have that appearance, and they can be quite numerous on the face. They can occur not only in adults commonly and neonates, but the other population that commonly develops sebaceous hyperplasia is individuals who are organ transplant recipients on the medication cyclosporin. For whatever reason, they have a very, very, very high rate of sebaceous hyperplasia. Then there's also, some rare genetic conditions in which sebaceous hyperplasia is present along with other skin lesions, but that's nothing to worry about. For the most part, sebaceous hyperplasia is something that is very, very common. What to do about it? Well, first and foremost, I would tell you, you have to go and see a dermatologist for evaluation and management rather than, assuming that it is sebaceous hyperplasia, or you have sebaceous hyperplasia and you have a new bump and assuming the new bump is more sebaceous hyperplasia. And the reason I really, really would push you to try and see a dermatologist sooner rather than later is that sebaceous hyperplasia oftentimes occurs on the face in areas of chronic sun exposure, and it can look an awful lot like some of the most common skin cancers out there. And some of the most common skin cancers out there can look an awful lot like sebaceous hyperplasia. They can look very, very similar, okay? So it's not to alarm you and just saying like this is, you have to be terrified that this is a skin cancer, but don't just assume that it's something benign like sebaceous hyperplasia. It's best to have it evaluated just to make sure that it's not a little skin cancer that would need to be removed, okay? So that is step number one. Oftentimes a dermatologist will tell you, yeah, it's sebaceous hyperplasia. It is what it is. There's not a whole lot that can be done about it. It's a cosmetic issue, period. And I think that can be very frustrating to hear, but it is the truth, okay? Sebaceous hyperplasia is not dangerous. It's, a purely cosmetic concern at that point. However, let's just take a step back and recognize the fact that the way we appear in our appearance and things that present on our skin do impact our overall well-being and our emotional health. And that's really an important part of health outside of just a cosmetic issue. And so it's definitely something to speak up on if you're having feelings of really being bothered by it, okay? So at that point in the conversation, the onus is on you as the person, as the patient, to speak up and say, but this is really affecting my emotional health. And that can kind of trigger the provider to be like, okay, let's take this to the cosmetic procedures then and pursue those. They're definitely worth pushing on this person. But sometimes some of the hesitation to push those procedures on you is the fact that they're not covered by insurance, and so they don't want to make you feel like you've got to buy something to fix something that doesn't necessarily need fixing, okay? So that's kind of how I would encourage you to look at that conversation where it feels a little disheartening as the individual hearing it, because they're obligated to tell you the truth. There are a variety of procedures that can be done in the office to, quote, zap them. There's something called an electrodesiccator, which is just like a little electric tip. I mean, it's used for many, many things in dermatology, and it can kind of burn them a little bit, and they kind of scab up and go away. They can come back, however, so just be aware of that. And that's pretty safe, pretty fast. You can put a little numbing medicine underneath the bump so you don't feel the zapping. And, it scabs up, flakes off. There's a small risk of it scarring or leaving behind a white mark, but for the most part, because sebaceous hyperplasia is pretty high up in the skin, it's not really likely to scar, so it's pretty safe. There's also, I talked about microdermabrasion can kind of be a little bit helpful for milia. Sometimes it may be pursued for sebaceous hyperplasia, but it's less impressive. Peels, not so fantastic as far as outcome and results. Using a topical retinoid, however, can be helpful. If the individual is prescribed a topical retinoid, that can be helpful in just kind of helping some of them actually go away and minimize the appearance of them, because tretinoin and retin-A, adapalene, differin, they all concentrate in the sebaceous gland, okay? And this is basically just a sebaceous gland that's gotten a little bit too big on the face and led to this bump. So they actually can be helpful for that. And it's oftentimes recommended. But I caution you about, if you've got them around the eyes, be very, very careful. Talk to the dermatologist about if you should actually be putting retinoids around your eyes, because the skin of the eyes is very, very thin, and you're likely to get a lot of irritation there if you go, slapping a lot of retinoids around your eyes. So be careful. Talk to them about if there is a cream that would be helpful, but sometimes sebaceous hyperplasia can be mitigated by consistent use of a topical retinoid. And, for people who have a lot of them, sometimes certain resurfacing lasers can be helpful in just kind of, getting rid of them, just kind of plowing the field a little bit, so to speak, sort of kind of a mowing over them and helping them to go away. But nothing that is done is really going to prevent them from coming back, unfortunately. So why do they occur? Is there anything to prevent them from occurring? There's not. They occur, we're not really entirely sure, okay? It used to be speculated, well, perhaps it's related to sun damage, since it tends to occur in older adults. But it also occurs in neonates, and they have zero sun damage, okay? And it also occurs in areas that are never exposed to the sun sometimes, like, in the groin areas. One theory is that as we age, the levels of androgens that both men and women have, okay? Androgens are the kind of more male hormones like testosterone. Those hormones actually play a key role in oil gland biology, all right? And, the oil glands are very sensitive to those. And they play a key role in kind of the rate of oil production and turnover of the oil gland to produce sebum, okay? And as those levels decline, kind of the normal maturation rate, if you will, of the oil gland is perhaps kind of now a little bit delayed. And so instead they just kind of sit on the couch in there and get a little big, and instead of turning over, they become just a little bit large, and you get a large sebaceous gland or sebaceous hyperplasia. So that's actually an interesting theory, and probably most likely what's responsible. No, I don't think that you should take it. There's no evidence, though, that taking like a testosterone supplement helps sebaceous hyperplasia. I don't think anyone's looked at that. We think perhaps it is related to that, but again, hard to say for sure. Earlier this week, I talked about extractions for pores. And sometimes comedone extractors may be used alongside the electrocautery devices in treating sebaceous hyperplasia. But you can't really extract sebaceous hyperplasia, so I wouldn't try. Again, I caution you against the comedone extractors, the pore extractors, or any of those kinds of devices. Next week I'm going to talk about microneedling and derma rolling on next Wednesday, but that has no role really. That has no role in treating sebaceous hyperplasia, if you're wondering. There is no cosmetic cream, there is no cosmetic ingredient, there's no cosmeceutical, vitamin, supplement, dietary supplement, food, nutraceutical, you name it, that can prevent or get rid of sebaceous hyperplasia. A topical retinoid used consistently is about the only thing that can be helpful. Do not expect a miracle. For the most part, like I said, it's a cosmetic concern, but if it's a cosmetic concern that impacts your emotional well-being, bring that to the attention of the physician, address it, and seek the cosmetic procedures to treat it. Be aware that you'll have to pay for them, but they're actually, depending on the one that is best for your sebaceous hyperplasia, they're really not the most expensive procedures that we have. I mean, they're kind of quick and easy bedside type things like the electrocautery. They're unlikely to be extremely costly to you, okay? It's not like it's not like plunking down cash for, say, Fraxel laser therapy treatments or, microdermabrasion packets or whatever. It's actually, these are some of the cheaper procedures to get rid of them, but do know that you may develop more of them. So while it's a cosmetic issue, we take cosmetic issues that impact emotional health very seriously. So speak up. Do not allow yourself to leave the office feeling badly. Do not allow yourself to walk away wounded. That is never the intention. So that would be my encouragement to you, is to just speak up at that point and say, hey, it may be a cosmetic issue, but it's a cosmetic issue that impacts my well-being. I want to treat it. And they will listen to you and help you select the most appropriate treatment. I know sebaceous hyperplasia is an incredibly frustrating condition to deal with. I will emphasize, however, don't self-diagnose it. There are many other both benign and malignant, meaning cancerous skin lesions that look identical to sebaceous hyperplasia, occur in areas of the skin alongside sebaceous hyperplasia. So it's best to see a dermatologist to confirm. And speak up if it bothers you, and ask about the procedures and the costs. They're generally some of the more affordable ones that you could pursue. So definitely worth addressing, and I hope you guys like this Q&A. I hope it was helpful. If you enjoyed it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. Talk to you guys tomorrow.